Early pregnancy symptoms vary from one woman to another. Some signs emerge in the first week, and more may emerge in the weeks leading up to your first missed period. If you're trying to conceive, look for these early pregnancy signs a week or two before your period. Morning sickness. Morning sickness is nausea and vomiting that typically come in the morning in early pregnancy. It can also happen at any time of the day or night. It is also a common early sign of pregnancy before you miss your period. Nausea can occur as early as 2 weeks into a pregnancy throughout the first trimester for some women, after which it subsides, while others have it throughout the entire pregnancy. Your body produces more estrogen and progesterone a few weeks after conception, which causes nausea and vomiting. Women who are unable to consume food or fluids due to severe nausea may have a condition called hyperemesis gravidarum. Though nausea and vomiting are common during pregnancy, it can cause dehydration. If you are experiencing dehydration symptoms, contact your doctor. Breast changes. Sore or aching breasts may be one of the first changes women notice during the first few weeks of pregnancy. The breasts may also feel tender to the touch, and in some women, the breasts may feel tingly after a few days of conception. This soreness is only temporary and will disappear once your body adjusts to the increased hormone levels. You may also notice that your breasts have enlarged, become fuller, or have become heavier than usual, and that your bra is tighter than usual. You may also notice your areolas, the circles of pigmented skin surrounding the nipples, beginning to darken and enlarge. This can occur as soon as 1 to 2 weeks after conception and is frequently the first sign of pregnancy. All this breast changes are due to rising progesterone levels in the body. A dark line called the linea nigra that runs from the middle of the abdomen to the pubic area may appear. Some women experience this symptom before their period, so it can be confused with premenstrual syndrome. Frequent urination. Around 6 weeks into pregnancy, frequent urination begins. During pregnancy, your body's blood supply increases. After conception, your kidneys start working harder to filter the increased blood flow, resulting in the urge to urinate more frequently. Later in pregnancy, the growing baby and the enlarging uterus may increase the urge to urinate by putting pressure on the bladder. Fatigue. Tiredness is common during the first months of pregnancy. The increased progesterone levels in a woman's body during pregnancy may cause fatigue and tiredness, as well as an increased need for sleeping. During this period, blood sugar and blood pressure levels are lower, resulting in frequent bouts of tiredness and sleep. These symptoms typically last throughout the first trimester and can be relieved by rest, a nutrient-rich diet, and plenty of fluids. Spotting. Some women experience spotting as an early sign of pregnancy, about 10 minutes 14 days after conception. It is a sign that your embryo has implanted in the lining of your uterus. When the fertilized egg attaches to the uterine lining, it causes irritation and light bleeding. Some women may mistake spotting for a light period and believe they are not pregnant. Implantation bleeding usually occurs about a week before the expected period. Small amounts of light pink or brownish blood may appear a week or so before your period is due. The bleeding will be a lot lighter than the usual period, and it will stop after 1 to 3 days. Sensitivity to smells. Because of increased estrogen levels, some newly pregnant women experience a heightened sense of smell early on. Scents that are not overpowering to others can be overpowering and unpleasant to a pregnant woman. Changes in food preference. A few weeks after conception, many pregnant women experience food cravings or aversions. Some women develop food cravings or experience constant hunger. You may find yourself craving foods you don't normally eat. Your favorite foods may cause nausea. You could also lose your appetite completely. Food aversions can develop during pregnancy, making you dislike foods you used to enjoy. Mood swings. Women who are newly pregnant may experience emotional, anxious, or depressive symptoms, as well as crying spells. Mood swings and stress-related feelings may be caused by rapid changes in hormone levels during pregnancy. Mood swings may be the worst in the first trimester, subside slightly in the second, and then return as the pregnancy nears its end in the third trimester. Cramping. Cramping is another early pregnancy symptom that can be confused with PMS or a regular period. Blood flow increases throughout the body during pregnancy. Cramping can be caused by increased blood flow in the uterus. These cramps are usually mild, but if these cramps are felt mainly on one side of your body or are severe, you should see your doctor. This could indicate an ectopic pregnancy or another complication. Bloating. Progesterone levels rise during pregnancy, which can cause abdominal bloating, fullness, and gas. Usually, the digestive system can slow down because of hormonal changes. This can cause bloating, constipation, or gas. And that's all for this video. Thank you for watching. Until next time.